Hello, Professor. I would like to talk about my future. I want to be like you and get a PhD in clinical psychology.
Why do you want a PhD in clinical psychology?
My friends say that I give really good advice and I like to help people and tell them what they are doing wrong.
You can still give advice and tell people what they are doing wrong without a PhD in clinical psychology.
I want a PhD. I think it's cool that people will call me doctor.
Who will call you doctor?
My patients will call me doctor.
Your patients will call you by your first name and will not even know that you have a PhD. They will be confused that you are a doctor who cannot prescribe them psychiatric medication.
My friends will call me doctor.
Your friends will laugh at you if you ask them to call you doctor.
My family will be proud of me and call me doctor.
Your mother will cry and ask you why you did not become a real doctor.
I need to feel proud of myself and I will call myself doctor.
If you need a PhD to be proud of yourself, you should go to a therapist because you have low self-esteem. Seeing a therapist will also be cheaper than going to graduate school.
As a clinical psychologist, I will make a lot of money in private practice. I will also make more money than therapists with their master's degrees.
You will have to spend your money on office space, malpractice insurance, licensure fees, continuing education credits, advertising, dues to the American Psychological Association, dues to your state psychological association, and dues to your county psychological association. You will also have to pay your student loans. You will have $100,000 more in loans than a therapist with their master's degree and only make $10 more an hour. Calculating your student loans, student loan interest, and delay in beginning your career as compared to someone with their master's degree, you will actually make $15 less an hour.
I will just see more patients so I can pay my higher student loans and one day buy my dream house.
Your student loan payments are based upon a percentage of your current income, so the more money you make, the more you will have to pay back every month. You will not be able to buy your dream house because you will have student loans the size of a mortgage.
My husband can buy our dream house.
Do you have a boyfriend now?
No, I do not. Why do you want to know if I have a boyfriend?
If you do not have a boyfriend now, you will not find a boyfriend if you go to a PhD program in clinical psychology.
I don't understand. I can date a nice sensitive man in my program who also wants to be a clinical psychologist.
There will be a few wonderful men in your graduate program. However, they will all be married or homosexual.
I will date someone outside of my program.
You will not have time. You will be attending classes, conducting research, studying, teaching classes, and spending thousands of hours training in a clinic or hospital to be a clinical psychologist, while a supervisor who you will not respect listens to recordings of all of your sessions with your patients and criticizes every sentence you say and convinces you that you are doing a horrible job until a week before your evaluation is due to your program, and then your supervisor will praise you for your improvement as a therapist due to the awesome feedback that he or she has been providing to you.
I can date someone after I graduate with my PhD in clinical psychology.
You will still not have time. After you graduate, you will have to get licensed as a psychologist and complete 1,750 additional training hours and study for the national licensure examination, which will test your knowledge of 11 different content areas in psychology, only 2 of which you actually use as a clinical psychologist. You will then have to pass a state licensure examination that may include an oral examination with arbitrary passing guidelines, which can add another year to your wait to be a clinical psychologist. If you fail this examination, you will not be licensed and you will have wasted the last 7 or 8 years of your life. If you are lucky enough to get your license, you will be at least 30 years old and just starting your career. All of your friends will be married with children, and only men with mental problems who want free therapy will want to date you.
With a PhD in clinical psychology, I can also be a professor like you.
Yes, then you can teach Introduction to Psychology. You could probably teach that class now as a senior psychology major.
You also teach abnormal psychology.
Yes. I get to hear students tell me about their mental disorders and why what I am teaching them about the mental disorders based upon my 10 years of experience is wrong, because what I am saying does not accurately describe the mental disorder that they think they have because they saw it on a cable television show.
Do you like working with your colleagues in the psychology department?
They are okay, but when you are a clinical psychologist, people think that you are crazy, so you have to always be extra nice so that people don't think that you are crazy.
Professor, why did you get your PhD in clinical psychology?
I wanted to be proud of myself and be able to call myself doctor.
Did it work?
No, I feel even worse about myself.
What do you suggest that I do? I really just want to tell people that what they were doing is wrong based upon my gut reactions and biases, because I feel that I have all the right answers even though I am only 22 years old.
Then you should be a life coach. You will not need any education or training. There will be no rules, regulations, or ethics. You can charge whatever you want and give direct advice based upon your own opinions. You can also open an online school providing fake life coach credentials and certificates.
That sounds perfect. I am now a life coach. That was really easy. Thank you.
You're welcome. I have to go home now to my studio apartment and feed my 4 cats. They also do not call me doctor.